Hello, I'm Dr. Janet Pope from Western University in London, Ontario, Canada, and I'm a Room Now reporter at Room Now. I'd like to talk about Sjogren syndrome and summarize some of the breakthroughs or areas of thinking from EULAR 2021 on Sjogren syndrome. So first of all, we know the quality of life in Sjogren syndrome is very poor, and it's been compared to other severe, serious chronic diseases with respect to quality of life. So the first study I'm going to talk about was a poster, POS 0102, and it looked at the quality of life in patients with Sjogren syndrome. And what it said, not surprisingly, was that if you ask the patients about their degree of sicca or dryness in their eyes and mouth, that it strongly correlates with their poor quality of life. So in other words, if you have mild complaints of dryness or sicca, your quality of life is better than if you have severe complaints. So something we can do is ask the patients and get firsthand knowledge of their quality of life. But if we want to find drugs that work, we actually need a disease activity index to see how drugs respond. So there was a study, POS 0105, which looked at the EULAR Sjogren Syndrome Disease Activity Index, or ESSDAI, EULAR Sjogren Syndrome Disease Activity Index. And it studied 511 patients and found that over half of the patients who responded to this survey to look at disease activity index and the physicians involved, over half the patients had moderate to severe disease activity index. Now, I do have to say that some of this might be symptomatology and not disease activity. And if we're going to look for drugs that might be effective in Sjogren's, we have to realize that there are residual symptoms, fatigue, secondary fibromyalgia, and damage to glands where the dryness will stay even if disease activity improves. However, despite my cautionary note, there was worsening of ESSDAI, the EULAR Sjogren Syndrome Disease Activity Index. When there was worsening, it was associated with worse outcomes. So I think in order to get drugs to work in Sjogren's, we have to also have a responder index, so disease activity and a responder index. And throughout this meeting, there has been discussion of validating a European responder index in systemic sclerosis. And I think more will come over time, and this is by a EULAR task force. In addition, we have to know how much damage is going on. And back in around 2008, a damage index called the Sjogren Syndrome Damage Index was published, and that was in Rheumatology, volume 47, in August of 2008. So I think we are now at the point that we're ready to know quality of life is poor in patients with Sjogren's. There is a disease activity index that's been validated. There is looking at a responder index that's virtually validated, and we know the residual damage. So I think we are really finally placed, finally, for our patients with Sjogren's syndrome to have positive trials if drugs are actually effective in Sjogren's. Please follow us at Room Now. Thank you.